As we age, our knees may become more prone to injury and overuse, and that could lead some people to think about knee replacement surgery. This morning on Ask a Specialist, we'll talk about what you need to know with Dr. Andrew Richardson, a knee reconstruction specialist at the Queens Medical Center. Dr. Richardson, good morning. Thanks for joining us today.
Good morning, Christine. Thanks for having me.
First of all, let's talk about the timing. When should someone consider this type of surgery?
Knee replacement is a surgery that's used to treat arthritis of the knee, which is age-related damage and wear to the cartilage within the knee joint. Patients should consider knee replacement surgery when they've failed a non-surgical approach and they continue to have severe pain and swelling, limiting their quality of life. And it's something that can really help improve the pain and improve their function and getting back to doing the things that they love to do.
And even though I hear that it's a common type of surgery, there are a lot of people out there who would love to avoid this type of surgery. So what are some ways we can do that?
Yeah, and so knee arthritis, unfortunately, is age. It is wear and tear of the joint. And so there's no way to prevent that from happening, but there's ways to manage the pain and swelling without surgery. Those include taking non-steroidal anti-inflammatories, including ibuprofen, Motrin Aleve, Tylenol, doing physical therapy and exercise programs to maintain the strength and range of motion within the knee. Braces, heat, ice, activity modification is always key. From a medical standpoint, we try to help pain a lot with injections, including corticosteroid injections, hyaluronic acid injections to lubricate the knee and reduce the pain and swelling.
And then what is involved in robotic total knee replacement?
Yeah, robotic total knee replacement is the new way that we're doing knee replacements. I've been doing robotic knee replacements now for the last several years. It's an instrumentation system that allows us to be more precise in the way we cut the bone, place the implants, and ultimately balance the ligaments within the knee. That gives us a better way to make the knee feel more natural and act more natural with the prosthetic. It therefore allows patients to have more natural feeling to the knee, a little bit faster recovery, and overall helps with the long-term outcomes from the knee replacement surgery itself.
All right. Now, to learn more about the services provided by Queens Orthopedics Department, you can visit www.queens.org, click on services, then click on orthopedics, or you can always contact Queens Orthopedic Associates at 808-686-4010. Dr. Richardson, thank you so much for joining us today.
Thanks for seeing me. Have a good day.
You too.